Okay, so many people my age are getting their first taste of independence in ways such as getting their driver's licenses, figuring out how to start planning road trips with their friends, and having those increasingly unclear conversations with their parents about adult things like insurance. For example, when I first heard the word deductible, I assumed it meant money that was deducted from the bill, like a discount. That is not, in fact, what a deductible is. A deductible is money that is deducted from your bank account first, before the insurance starts helping. Yeah, whoever named it that definitely worked in marketing. But the point is, we're hearing these terms and we're nodding our heads, but we're actually hope we don't have to understand them anytime soon. We're suddenly pretending to understand car insurance because nothing says adulthood like signing a document you didn't fully read. But that makes me wonder, if something as replaceable as a car needs protection, what about something that's irreplaceable, like our health? What if health insurance wasn't treated as a complicated privilege, but as a fundamental need, like clean water or education? Because adequate health care doesn't just help people recover from illness. It creates a sense of public well-being and equality in communities. But right now, millions of Americans live in this strange reality where insurance exists, but its protections often go unused or misunderstood. Even people with coverage try to avoid getting care even if they really need it because they're afraid of costs that they can't predict. And others who are eligible to enroll don't simply because they don't know what their options are. This is the critical gap that we need to address. Protection is most effective when we know how to take advantage of it. So that brings me to my question. What if everyone, insured or not, could navigate health insurance with confidence? According to the CDC, 27 million people in America didn't have health insurance in recent years, starting in 2022. That's about 8% of our country's population. And it created significant financial uncertainty for all of those families. But conversely, according to the Census Bureau, about 90% of our country's population did have some form of health insurance, but that doesn't necessarily mean they all felt confident using it. People hesitate to get preventive services or even seek medical care altogether because when they do choose to use their insurance, they can face more surprise costs than what they were expecting. And let's be honest, medical surprises in envelope form aren't usually a good thing. But these surprises often go or happen because people don't understand their coverage. And this issue is increasingly crucial today. We live in this era of rapidly rising healthcare costs and treatment options and a vast, I mean vast amount of information and misinformation available at our fingertips. According to the Centers for Medicare and Medicaid Services, healthcare spending in America reached a whopping $4.9 trillion in 2023, or with some simple math, about $14.6K per person. When a system carries that level of economic weight, even a single misunderstanding can create significant, colossal consequences for families. And at that price, I mean, you'd at least expect a clear instruction manual. At the same time, though, the lessons of the pandemic reminded us that health decisions are rarely just personal. They ripple outwards, affecting schools and workplaces and entire communities. Now I'm going to tell you the story of Deborah, a 60-year-old woman in Montana who didn't have health insurance after she lost her coverage. One day, she fell and broke her elbow and needed to get surgery, but following the procedure, she received a bill from the hospital for $98,000, which, as I'm sure you can imagine, was way higher than what she was expecting and the original estimate. But the hospital responded saying that the higher cost was due to unexpected mid-procedure complications and indicated that they were reviewing the bill with the staff, but they ended up sticking to the original charge. After being misinformed about her rights and how she could refute the bill under federal law, Deborah was eventually forced to enter this super long and arduous $100 per month payment plan instead of actually challenging the bill like she should have. Her experience shows us that confusion about costs and billing processes and just insurance protections in general can create this overwhelming strain and headache that nobody deserves. And there has been a lot of research surrounding this issue. In 2018, Mary Politi, a behavioral scientist at Washington University, conducted a study on the association between health literacy levels and avoidance of healthcare services owing to cost. And she found that people with lesser knowledge on the subject had significantly higher odds of delaying and foregoing both preventive and non-preventive healthcare services because of perceived costs. And in a survey of over 500 insured US adults, around 38% of them reported that they resisted care even when it was required because of the same reason, cost. When people understand their coverage, it's easier for them to get preventive services and manage things like chronic disease and get a better idea of the costs that are associated with their coverage. But on the other hand, uncertain individuals are far more likely to jeopardize their health and just hope that an issue resolves itself on its own rather than risk incurring an additional medical expense. It's striking to see that in a country that's made such great strides in medicine, that people still don't get the care they deserve because of these reasons. The good news is, though, we can change this. The use of digital tools and other resources like plain language guides plus outreach programs is already helping people access information about their insurance and clear up common misconceptions surrounding the topic. For example, I'm sure many people in here think or have thought that if they don't have health insurance, it means they're not protected, but that actually isn't the case, and even uninsured individuals are eligible for certain select essential medical services. They just need to know how to access them. And websites like healthcare.gov allow families and individuals to compare plans and estimate costs and figure out what kind of financial assistance they can receive. And similarly, many states in America offer Medicaid caseworkers and navigators who are trained professionals who can help you figure out what plan is best for you. But in order to actually empower people, we need to educate and engage them in conversations about their options. Coverage only works when people understand it, and nobody should need a law degree, a finance degree, and a decoder ring just to go to the doctor. Too often, understanding health insurance feels more complicated than something like assembling furniture. And trust me, that's definitely saying something. I mean, if millions of Americans can figure out how to successfully put together IKEA furniture with only picture instructions, we can probably figure out a way for everyone to take advantage of the healthcare insurance system too. If we stop treating the process of understanding healthcare as something that requires specialized knowledge and instead treat it as a basic life skill, what changes will occur? Imagine a high school graduate who has a working knowledge of their own coverage plan. Imagine a family who knows how to estimate their out-of-pocket costs and feels well prepared before any kind of medical emergency. Imagine an older individual who isn't overwhelmed by the fine print and knows how to choose a Medicare plan based on their options. Imagine lower-income families who know when they're eligible for Medicaid. As awareness increases, protection is more likely to go from a privilege for a few people to a right for everyone. So, going back to my original question, what if everyone, insured or not, could navigate health insurance with confidence? we realize that it isn't just the presence of health insurance that causes protection, but the knowledge of how to choose and use it. Just like how an education provides us with a better future and clean water protects our bodies, understanding health insurance can help protect our health. Rather than assessing success based primarily on the number of people who just have insurance, it would be beneficial for us to focus on and address the number of people who actually feel empowered to use it, regardless of whether or not they're on a plan. They just need to know how to take advantage of the system. Because resilient societies don't just provide their citizens with a variety of protections, but also help them confidently navigate how to use them. Thank you.